I'm Danielle Pinkerton, aged 54, from the United States of America. In July, I moved to Dubai, and one of my biggest priorities was to find great health care. As a previously diagnosed Crohn's patient, it was important to me to find a gastroenterologist with experience in this area. Through my research and through the reputation of King's College, I happened upon Dr. Farooq Khan. In my initial meeting with him, he did an overview of my problems, how I was dealing with my Crohn's disease. And one of the areas we identified is that I was suffering from acid reflux disease. Over time, he tried to help me with various medications. After 6 months, he recommended that I go through a TIF, which is a Transoral Incisionless Fundoplication of my esophagus and my stomach to help reduce and eventually eliminate any form of acid reflux. With the TIF procedure, most patients can be discharged within 24 hours. Since I had some serious esophageal erosion, I ended up with a 2-day stay in the hospital just to make sure that my pain management was under control. While there were slight few days of discomfort, probably the biggest challenge was maintaining a completely liquid diet, clear liquids, for multiple weeks. Each patient has their own journey in the process with the TIF. I went on liquid diets to soft food. Around week 6, I was able to start bringing other solid foods back into my diet. My experience with Dr. Farooq is very informative, very easy. He makes me comfortable and asks for my opinions and how I'm feeling every step of the way. I'm really thankful for my whole team here at King's College. Along with Dr. Farooq, he has helped me position with various doctors that continue to help me on a journey to success and full health. The team has been amazing. From caring, they all know every detail about every time I've been in the hospital. They have looked after me and sometimes worked with each other to make sure that I am getting the best care possible.
Hi, I'm Farooq Khan. I'm one of the consultant hepatologists and interventional endoscopists here at King's College, Dubai. Danielle had a very different presentation. In fact, the reason she started to come in and see us was difficulty losing weight, difficulty sleeping, snoring, and when we dig down, we found out that in fact she's having quite severe reflux symptoms. Here at King's, in our reflux clinic, we go through, because it's all research-led, we go through the questionnaire. We use GERD 𝐏𝐻QRL questionnaire, and her score was actually 38. It was quite high. She was having all the symptoms, heartburns, reflux of food into her mouth, and not really been able to achieve any quality of life despite being PPIs. She has gone through all the assessments as one would expect, include pH study, esophageal manometry, and she had an incompetent valve at the lower end of the esophagus. We discussed in our MDT, and it was thought that she would be an ideal candidate for minimally invasive endoscopic intervention, and she had Transoral Incisionless Fundoplication, known as TIF. It's a day-case procedure we offer here at King's, and I have an excellent support from anesthetic as well as dietetics when we offer this to our patients. Danielle had a procedure that really lasted about half an hour. She had an uneventful recovery. She stayed with us for a few hours. We planned a special diet. We normally, when they discharge, they do get discharged on acid-reducing tablets, although our intention is that as we see them on 2 weekly basis through our program, we eventually reduce and then stop the tablets. And I was really pleased to see that not only she's managed to get rid of her symptoms completely, she actually stopped taking her acid-reducing tablets on week 4. Really amazing and pleasing to see that she has got no symptoms. She is managing to get the night sleep. She's getting 8 hours sleep, and her life has completely transformed what we have known through a minimally invasive day-case procedure.